It's 10 years this month that SARS hit our shores. Our reporter looks at how hospitals here have progressed in terms of readiness to tackle outbreaks.
A mysterious pneumonia case surfaced at Tan Tock Seng Hospital in early March 2003. The female patient had a fever which refused to go away despite regular treatment. Within a few weeks, cases were reported in nearly 40 countries, and the World Health Organization issued a global alert. At that time, Dr. Liu Yi-sin was one of the few infectious disease specialists who had some experience with outbreak management.
I set up a tiny little table just outside Ward 72. That was our original place where we started the triage management for SARS. It was really hot. I always remember the staff working there really sweating away, and their face turned pale and they're so exhausted, but they still soldier on.
Tan Tock Seng Hospital was designated SARS Central. By the end of May 2003, Singapore was SARS-free. Since then, healthcare institutions have strengthened their operations to better prepare themselves for a similar outbreak. For example, fever screening facilities in the Singapore General Hospital were improved. The area between these two sliding doors is called the ante-room, and it acts as a buffer zone between the normal area of the hospital and the fever zone right here. Now, the objective of this space is to minimize the intermingling of air between both areas before potentially infectious patients are brought into the fever zone.
Prior to SARS, in all hospitals, whether in Singapore or in any other country in the world, there were no specific fever isolation facilities in emergency departments. The practice of also hand-washing patients before and after seeing every single patient was not there in place.
More investment has also been placed into rapid diagnostic tests.
If we know we have a problem, then we can react faster to it, and we can get all the follow-on actions, contact tracing, isolation, quarantine, treatment.
But while better infrastructure and operational processes are the result of SARS, many say surviving an outbreak all comes down to having a dedicated team of healthcare workers.